I'm Nicole. I'm going to be your nurse practitioner today.
Great. I'm Jen. Pleasure to meet you.
Nice to meet you. What's bringing you into the clinic today?
So I have been training for a marathon, and for about the past 3 weeks, my left knee has been hurting, and it's getting worse every time I'm running.
Okay, all right. And when did it start hurting?
About 3 weeks ago, and it only hurts when I'm running on it, and it just seems to be getting worse and worse over the past 3 weeks.
Okay, and then it's just the knee? What part of the knee?
Just this left knee, like kind of right under the kneecap area.
Okay. And is it, you said it's only hurting when you're putting weight on it, or when you're running specifically?
Yeah, when I'm running specifically, yeah. It's starting to hurt a little, like when I'm walking around as well, but mainly when I'm running.
Okay. How would you describe the pain?
Kind of it's like an aching, and then occasionally I'll get some sharp pains with it as well.
Okay. Does anything make the pain better? Have you tried anything?
I have. I've taken ibuprofen, and it does help. It's not helping as much the last week or so, which is what brought me in to see you.
Okay. And then what makes it worse? Just the running, or anything else that you've noticed?
Nothing. The only thing I've noticed is the running.
Okay. Does it radiate anywhere? Does it go up your leg, down your leg?
Nope. Stays right there around the kneecap.
Okay, perfect. And then at 0 to 10, how would you rate the pain?
At rest, it's not bad. Maybe like a 1 if I feel it at all. And then while running, the strongest it gets is about a 6.
Okay. And right now it's a 1?
Yes.
Okay. So now we're just gonna go through your history. I'm gonna ask you a bunch of questions. If at any point it's uncomfortable, or if you need to take a break, just let me know.
Okay.
Okay. We're gonna start with your personal history.
Okay.
Medical wise, do you have any chronic medical problems?
Nope.
Okay. Any surgeries before?
I've had 3 C-sections.
Okay. What were the dates of those?
I had one in 2018, in July of 2018. I had another in March of 2020. Oh my gosh. And then another in October of 2022.
Okay, perfect. And those were all C-sections?
Yes, ma'am.
Okay. Any other hospitalizations?
No.
Just the 3 with
just the 3 with my pregnancy.
Okay.
Yep.
And then any like medications that you have to take daily?
I do take a multivitamin, but
okay.
No prescription medications.
Okay. No other vitamins or herbals or any other supplements like that?
Nope.
Okay, perfect. Any allergies to medicine?
Nope.
Any allergies to the environment? No food allergies, nothing like that?
Nope.
Okay, and when was your last menstrual period?
I started 3 days ago.
Okay. And you said the 3 pregnancies, are those your only 3 pregnancies, or have you had other pregnancies?
Those are all my pregnancies.
Okay. Are you up to date on your immunizations?
I am, yes. Okay. I got my flu shot last week.
Okay, flu shot last week, and then have you gotten a COVID shot recently?
It's been a year since my last COVID shot.
Okay, tetanus?
Tetanus was with my last pregnancy, so about 2 years ago.
Okay, and then have you gotten like a pneumococcal vaccine?
I have not.
No pneumonia, nothing like that?
No.
And you had all your childhood vaccines?
I did.
Okay, perfect. Any diet restrictions? Any exercise problems?
Nope.
You're running for a marathon.
I am, yes.
So that's good. Obviously no issues exercising.
Nope, just the knee, but no other issues. Yeah.
Okay, perfect. And then no problems with your diet or anything?
Nope.
Okay. Family history wise.
Okay.
We're going to start with your parents, or I'm going to just ask what their medical history was, and then if they're alive and well, or if they've deceased.
Okay.
So your mom and dad?
My mom is alive, and she has a medical history that includes high blood pressure.
Okay.
But other than that, she's good.
Okay.
My dad is also alive, and he has high cholesterol.
Okay.
But besides that, he's well and good.
Okay. And then do you have any siblings?
I have a brother.
Okay. Any medical problems?
Nope, he's still alive and no medical problems.
How old is he?
He's, 37.
And how old are your parents?
My parents are both 63.
Okay. And then we're going to do your grandparents, so your mom's mom.
My mom's mom is deceased. She had a history that included leukemia. That's ultimately when she died, and that was in 2019. And then her dad is also deceased. He died in 2009. 2009. Okay. I'm so sorry, 2009.
No, that's okay.
And then my mom's dad died in 2010, and he had died of alcoholism, but had no other chronic medical problems. My dad's mom is also deceased. She died in like 2006, I think, and to my knowledge, didn't have any medical problems. And then my dad's dad died in 2009, and he had CHF.
Okay. Yeah. And do you know their ages that they were when they passed?
My dad's parents died in the mid 80s. They both were, and then my mom's parents died in their late 70s.
Okay. And then as far as your just family history, you have your mom's mom had leukemia. Any other cancers?
No.
Heart disease?
No.
TB?
No.
You said some hypertension for your mom.
Yes.
Any diabetes?
Nope.
Any genetic conditions?
Nope.
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 Okay, great. Then we're gonna just do your personal history, your social history, where we ask you some personal questions.
Okay.
First, are you married?
I am.
Okay. To a man or a woman?
To a man.
Okay. And you have 3 kids at home?
I do.
Any pets?
Yes, I have a dog and a cat.
Okay. What are their names?
My dog's name is Shiner and my cat's name is Mojito.
Cute. Okay. And so, any alcohol use?
Just socially, maybe 2 drinks a week.
Okay. And what kind of drink is that?
Depending on the day. Sometimes beer, sometimes wine.
Okay. Any smoking, vaping?
No.
Any drug use?
No.
Okay. Any religious preference we should know about?
No.
Spirituality? Anything like that? No. Okay. And what do you do for work?
I'm a nurse.
You are.
I am.
Okay. Any occupational hazards?
No, I mean, I'm on my feet quite a bit, but besides that,
You wear your PPE.
I wear my
You
PPE.
get
I wash
your
my hands.
vaccines.
Yes.
Okay.
I follow all the rules.
Are you ex-military, current military?
No, ma'am.
Do you travel frequently?
No.
Okay.
No, I got 3 kids. I'm not allowed
Yeah.
to travel.
That's understandable. Okay. I'm gonna move on just to a review of your systems. This is basically like we're just gonna go head to toe and talk about all the parts of your body and everything that you're going through. Okay.
Okay.
First is just general. Any fevers, lethargy, weakness?
Nope.
No night sweats?
Nope.
Nope. You feel overall healthy and well.
Yes.
Okay, perfect. And we talked about your diet a little bit, but what's a typical diet day look like for you?
I eat breakfast every day, and I mean, I do the typical 3 meals: breakfast, lunch, and dinner. An occasional snack here and there. I do some red meat occasionally, but I try not to do too much. Mostly, I do is like lean meats, chickens and fish and stuff like that. Nothing. I try to stay away from. I'll do like eggs in the morning, but I try not to do too much bacon and greasy things like that. I try to remotely healthy-ish.
Okay. And then just while I'm thinking about it, sleeping okay?
Yeah, usually about 7 to 8 hours a night.
Okay,
Yeah.
and your mood's okay? No mood issues that you've noticed? No problems concentrating?
My husband might disagree, but yeah, no issues.
No problems concentrating? And
No.
Okay, perfect. Your skin, do you notice any lesions or any wounds or
Nope.
anything with your skin?
Nope.
No rashes, no itching?
Nope.
Nothing like that?
Nope.
Hair, does your hair grow normally? Have you noticed any issues with your hair texture, growth?
Nope, totally normal.
Okay.
No issues.
And then your nails, have you noticed any like discolorations, any
Nope.
stripes in the nails, any brittle nails, nothing like that?
Nothing like that.
Your head, you don't have any headaches?
Mm-mm.
No.
Mm-mm.
No lumps that you've noticed, no
Nope.
dizziness,
Nope.
nothing. Okay. And your ears and discharge, pain, ringing in your ears, nothing like that.
Nothing like that.
Eyes, seeing okay?
Yep.
Do you go to the eye doctor?
I don't have an eye doctor, no. I've never needed contacts or glasses or anything. I get my eyes checked just as part of my physical, but I do not have an eye doctor.
Okay.
No.
But you've not noticed blurry vision, no discharge, no pain with your eyes?
No, ma'am.
Okay, and then your ears.
Mhm.
We already covered your ears. No
Yep.
problems with that. Any nose, mouth problems?
Nope.
You don't have any bleeding gums?
Nope.
When was your last dentist appointment?
Just 2 or 3 weeks ago. I did have to get a cavity filled,
Okay.
which I'm very ashamed of. But yeah, it was like 2 weeks ago.
Okay.
Yeah.
And so no problem swallowing, no problems
Nope.
eating. Your teeth all seem fine other than that one cavity.
Correct.
And then your neck, you haven't noticed any lymph nodes, any discolorations,
Nope.
any like pain in the neck or anything like that?
Nope.
Okay. When was your last checkup with your doctor?
6 months ago, give or
Okay.
take. Yeah, because I'm due for another one in 6 months.
Gotcha. Okay, perfect. And then have you ever had a mammogram?
I have not.
Have you ever had a colonoscopy?
No.
Okay.
Lucky me.
Yes. Respiratory wise, are you coughing? Are you short of breath?
Mm-mm.
No.
Nope.
No sputum, nothing that you've noticed there.
Nothing.
With your heart, do you feel palpitations, chest pain?
Mm-mm.
No. Okay. Do you sleep with 1 pillow, 2 pillows?
Usually just one.
Okay.
Yeah, no
Okay.
issues.
And no swelling to your feet or legs or anything that you've noticed?
Nope.
No. Okay, perfect. Let's move on. And we've talked about your diet, but as well as like bowel movements and everything goes normal.
Very regular, yeah.
Okay, how
About
often?
about once a day.
And you would describe them as regular bowel movements.
Yeah.
No constipation, diarrhea.
Nope.
Any heartburn, nausea.
No.
No vomiting.
Mm-mm.
No. Okay. You don't feel like you have any lumps or masses in your stomach. Or
No.
any kind of
No issues.
Okay. Muscles and skeleton, like your bones and everything. No joint pain aside from the knee.
I was gonna say the knee. What brought me in, the occasional soreness after I've been training, but besides that, no issues.
And you have good range of motion with all your muscles, and
Yes.
you don't have any joint pain, swelling, redness, nothing like that.
Nothing
Good.
like that.
Okay. Pelvic wise, you said your period just started a couple of days ago.
Mm-hmm.
Any pain with intercourse?
Mm-mm.
Do you know what age you were when your first period was?
14. Yeah.
Okay. And you said there hasn't been any issue with peeing.
No.
No, you're not dribbling. You're not incontinent.
No.
Nothing like that.
No.
Okay. Good.
Thank goodness for C-sections.
And then any back pain, kidney pain, nothing like that.
No.
Okay. Breast. You do breast self exams.
I do. Yes.
How often are you doing that?
I try to remember to do it like once a month. Like, isn't it like the first of the month you're supposed to do it? Realistically, it's probably every 2 or 3 months.
Okay.
Mhm.
And then you haven't noticed any like lumps, discolorations,
Nope.
nipple discharge, nothing's going on with
Nothing.
that.
Yep,
Okay,
all
perfect. So have you noticed any like lymph node swelling,
Mm-mm.
anything like that with your legs? Are your feet or legs discolored? Any blood vessels? Any kind
Nope.
of issues with the nothing with your veins or anything? You don't
Nope.
see any varicose veins or anything like that?
Nope.
Okay. Any easy bleeding, easy bruising? Do you feel like you bruise more often than the average person?
No, I'd say pretty average.
Your gums aren't bleeding or anything
Nope.
like that. Okay. Are you intolerant to the cold or the heat? Do you have any issues with that?
No.
No?
No.
Okay. Have you been excessively hungry or thirsty lately?
No.
No. And you're not like going to the bathroom more often than normal, like peeing more often than normal?
No, ma'am.
Okay. And then just no dizziness, no headaches, no neurological symptoms.
Nope.
You haven't been passing out, losing consciousness, or anything like that. You feel like you have good balance and everything.
Yes.
Okay,
All
perfect.
feel good.
All right, now we get to do your assessment.
Okay.
Set this down. All right, I'm gonna wash my hands.
Okay.
So if at any point you get cold, uncomfortable, anxious, just let me know. We can always kind of change things up to make you more comfortable, or anything needs to be deferred, we can do that too, okay?
Okay.
All right, so first thing we're gonna do, I'm just gonna look at your skin.
Okay.
I don't see any lesions or anything. If I did see a lesion, I would measure it. I would note how wide and long and any elevation. I would note the pattern, shape, texture, distribution. If there was exudate, I would just kind of note the color of that, the odor of that. I would send it off to the lab if I saw anything.
Okay.
Skin looks good. I am going to ask you just a few like general orientation questions too, just to make sure that you know where we are and what's going on.
Sure.
Okay, so your name and birthday.
Jennifer Gilson, 32590.
Okay, we have the same birthday.
Do we?
Yeah,
I
but
love
I'm
that.
a little older.
Oh, okay.
Okay, but that's okay. And then where are we right now?
We are at your clinic,
Okay. What city are we in?
McKinney.
Okay, and the date?
10/4/24.
Good. Okay. Who's the current president?
Joe Biden.
Okay.
That's a hard question. Sorry.
I know, do you know who the last two presidents? It gets harder.
Yeah, the last two, there was Trump, and then before that, I think Obama, right?
Yes.
Okay.
You're good. You're
Sorry.
I know, it's hard. I come with the hard questions. I'm going to give you 3 words to remember, and then
Okay.
at the end of the exam, I'm going to ask you to repeat those.
Okay.
Okay. Red,
Red,
hippo,
hippo,
boat.
boat.
Yep.
Okay.
Got it?
Red, hippo, boat. Yes.
Okay, so
Okay.
patient's not in any distress, no signs of pain right now. She's alert and oriented ×4. Her long-term memory is intact. I'm just gonna take a look at your hands and your fingernails.
Oh, sure.
So skin is pink, warm and dry. The nail beds are pink. Capillary refill is brisk. Can you do this for me? Just
Okay.
No signs of clubbing in the fingernails. I'm gonna just feel your radial pulses. They're +2 bilaterally. Brachial pulses are also +2 bilaterally. Epitrochlear nodes and axillary nodes are not palpable, which is good. That's normal. Okay.
Excellent.
Do you have good range of motion in your hands?
Yes.
Okay, I'm
No
gonna have you do
issues.
this.
Okay.
Do this. Do this. Up and down with your elbows. And then arms up and down. And then out. And then you're able to kind of shrug your shoulders.
Yes.
Okay, good range of motion in the upper extremities. Can you grip my hands?
Oh, yeah.
Okay. And now just push up, push down. Okay. Straighten your arms out, up, down, push out, and in. Perfect. Okay, good strength bilaterally. Next thing that we need to do, I'm just gonna palpate and let me know if you have any pain or tenderness.
Nope.
Nope. Okay, good musculature symmetrically. And now we get to check your reflexes.
Okay.
So you just stay right there. I'm going to have your arm kind of bent.
Oh, sorry.
You're good. This is your tricep. Just relax your arm.
Okay.
Okay. Next is going to be your bicep and your brachioradial.
Oh, sorry.
Okay, good. Do this arm, tricep. Okay. Bicep and brachioradial. Okay, so reflexes are normal throughout the bilateral upper extremities. Next, we're just going to do just some rapid hand movements. So put your hands on your knees. We're going to go back and forth as fast as we can. Okay, perfect. Now touch your nose to my finger. No, yours. Touch your nose and touch my finger.
Okay.
Sorry.
I was like,
You can do that too. All right, there we go. That's good. And now the other hand. Okay, good.
I know, good.
All right, next we're going to do a test for stereognosis. So I'm going to have you close
Okay.
your eyes. I'm going to put something in your hand and you're just going to let me know what it is, okay?
Okay.
Right hand first.
This feels like a key.
Okay, good. Correct. And your left hand next.
Battery.
Perfect. Okay, good. Okay, we're going to move on to the head and the face.
Okay.
Okay. I'm just inspecting your head and your hair. It looks clean, well groomed, normal growth distribution. Your face is symmetrical, no lesions or anything noted on your face. I'm just going to palpate. Let me know if you feel any pain.
Okay.
I'm palpating for any tenderness, lumps, masses. Any pain with that?
Nope.
Okay, no lumps or lesions noted. Sorry. And then I'm just going to feel your sinuses.
Okay.
Any pain with palpation here?
Nope.
Okay, good. And then I'm going to percuss. Let me know if anything hurts. Your maxillary, frontal sinuses, maxillary sinuses. No issues with that?
Nope.
Okay, I'm going to test cranial nerve 7. So puff up your cheeks. Perfect. And now frown.
Wall puffed.
No, you can
Okay.
let the air out and then frown. Good. Okay. So
Something like that's hard.
that is hard. Sorry about that. Cranial nerve 7 is intact. Okay. Next, I'm going to auscultate your temporal arteries and see if I can hear any bruise or anything abnormal there.
Okay.
Okay. No bruise noted, so that's normal.
Excellent.
Okay, we're going to move on to your eyes first.
Okay.
Okay. So I'm just inspecting your eyes. I don't see any discharge, redness, swelling. I'm just going to check your conjunctiva. Looks pink, moist, and intact. The sclera is white, the iris is brown, and the cornea appears clear and intact. Good. Okay. This first test is the Hirschberg's test. It tests for corneal light reflex. So you'll just
Okay.
look straight ahead, and I'm going to shine this right on the nose. Okay. And I see the corneal light reflex in bilateral eyes. Next, I'm just going to have you follow my pen. We're going to test your 6 cardinal fields of gaze.
Okay.
Just follow with the eyes and not the head. Okay.
Okay.
Okay, good. Cardinal fields of gaze are intact and normal. I'm going to take a look at your pupils, okay?
Okay.
All right, just look straight ahead. Pupils are equal, round, reactive to light, direct light, and consensual light. All right, and then I'm going to have you look at that wall right behind me.
Okay.
Okay. Now look at my pen. Okay, accommodation is also intact. That's good. Okay, next thing we're going to do is it's called the cover-uncover test. So you'll just look straight ahead and I'm going to cover each eye, okay?
Okay.
Okay, good. So I didn't see any extra eye movements, anything abnormal with your eye movements, so that's what that test was for, and so that looks totally normal and good.
Excellent.
Okay, now I'm just going to palpate your eyes, okay?
Okay.
Just external. I don't feel any bumps or deviations or masses. Is there tenderness with my touch?
No tenderness.
Okay. Now I'm just going to look for the internal structures of the eye. Just want to turn on. Okay. You got to be right here in your personal space just for a minute.
Okay.
So I'm just inspecting for the retina, visualize the retina, the red reflex, the optic disc, and the vessels are all within normal limits. I'm gonna do your other eye next. Visualizing the retina, red reflex, optic disc, and all the vessels are intact. Okay, good. Next, we're gonna do your ears.
Okay.
First, I'm inspecting and palpating your ears. I don't see any redness, any swelling, no lesions or bumps or masses. Is it tender with touch?
Nope.
Okay. The left ear also has no masses, any redness, any tenderness?
No, ma'am.
Okay, skin is pink, consistent with ethnicity. All right. We're gonna test your gross hearing.
Okay.
Okay, so I'm gonna get behind you. I want you to cover your left ear, your
Okay.
radius of your left ear, and I'm gonna whisper a few things into your right ear.
Okay.
Let me know what you hear, okay?
Okay. F. 2.
S.
S.
Okay, now we're gonna repeat it with your other ear.
7.
6.
6.
Z.
Z.
Okay, good. So that just tests your gross hearing, which was normal, so that is a good thing. The next test is called the Weber test, okay?
Okay.
So what you're gonna do is just let me know. I'm gonna strike this tuning fork. You're gonna let me know when I put it on your head like this, if you hear it in one ear more than the other, or if it's equal in both ears.
Okay.
Okay?
Equal in both ears.
Okay, good. So that's normal. The next thing is the Rene test, okay? So what the Rene test is testing is your bone and air conduction in your hearing.
Okay.
So I'll strike this, I'll put it on the back of the bone back behind your ear.
Okay.
When you stop hearing the sound, let me know. I'm gonna move it to your right in front of your ear, and then when you stop hearing that, let me know, okay?
Got it.
Okay.
Stopped. Stopped.
Okay. Do the same thing your other ear.
Stopped. Stopped.
Okay, good. So your air conductivity was twice as long as your bone conduction, which is normal. So that's good. So we had a normal Weber and a normal Rene. Next, I'm just gonna look into the internal structures of your ear.
Okay.
And you said you haven't noticed any ear issues or anything like that?
Nope.
Okay. Just gonna take a look. Let me know if this is hurting.
Okay.
Okay, so I'm visualizing the ear canal. I don't see any redness, no swelling, no fluid, and then the tympanic membrane is gray and pearly. Okay, that's good.
Excellent.
And I'm gonna open the other ear. Okay. The tympanic membrane is pearly gray. I don't see any redness in the ear canal. No swelling, fluid, or discharge. Okay. That is good. Now I'm just gonna look at your nose, okay? I'm inspecting the nose. I don't see any masses or any asymmetrical. Do you feel like you can breathe equally through both nostrils?
Yes.
Okay, can you cover one and breathe out? And the other? Okay, equal.
Yep.
Feels good. Okay. So both nostrils are patent. I'm just gonna palpate. Feels symmetrical, no lumps, no bumps, and feels like there's no deviations. I'm just gonna look inside your nose at your nasal mucosa.
Okay.
Look up for me. It looks pink and moist. I don't see any bulging or deviations, no redness, no discharge noted. Okay. Now we're gonna move on to the mouth, okay?
Okay.
First thing I'm gonna do is just take a look at your lips. They look pink, moist, intact. I don't see any lesions. They're symmetrical. I'm gonna look with my light inside your mouth. Let me know if this is too much or if it's too painful, okay?
Sure.
First, I'm just looking at the tongue, the buccal mucosa, the soft and hard palate, the gums, the interior cheeks. Everything is pink and moist. Can you say ah? Okay, uvula rises symmetrically and normal. Tonsils are not visualized, but that's normal. I'm gonna put on some gloves so I can palpate the oral cavity, okay?
Sure.
Okay, look, palpating the gums, the soft and hard palate, the internal mouth, the teeth are straight, white, no signs of caries, no bleeding in the gums, they're pink, no swelling. All right, and then can you just close your mouth and swallow for me? Okay, normal swallow. I'm gonna have you open and close a few times. Any pain with that?
Nope.
Okay, no crepitus found in the TMJ and no tenderness with opening and closing. Can you push your tongue against my hand? And then on this one too. Okay, good. All right. Now we're gonna move on to the neck, okay?
Okay.
First, we're just gonna inspect the neck. I don't see any masses. Skin is within normal limits, pink and normal for ethnicity, okay? And do you have any tenderness when I palpate here?
Nope.
No lumps or masses or pulsations noted. We are gonna just do a range of motion with your neck.
Okay.
So can you look up and down, left and right, and then ear to shoulder. Very good, okay. Next, we're gonna just feel all the lymph nodes in your head and your neck.
Okay.
Okay, this is preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and then hunch up your shoulders for me, and supraclavicular. Okay, none of those nodes are palpable, which is good, okay? I'm gonna go ahead and just palpate your carotid artery, and then I'll listen to it with my stethoscope, okay?
Okay.
Okay. Carotid artery is +2 bilaterally. And I'm just gonna listen to it quickly.
Okay.
Okay. Carotid artery sounds within normal limits, no bruits noted. Okay. Your trachea appears midline, swallow for me. Okay, good. I'm gonna go behind you and just palpate your thyroid, okay?
Okay.
So I'm just gonna have you look down and slightly to the left and swallow. Okay, and down and slightly to the left and swallow. Or right and swallow, sorry. Okay, so thyroid was palpated, no masses or abnormalities noted. Okay, next thing we're gonna do is just move on to your chest. I'm gonna first inspect your chest from behind, okay?
Okay.
So what I'm first looking for is a thoracic cage configuration. Your anterior and posterior thoracic cage is about twice that of your transverse thoracic cage, which is normal. There's no signs of viral chesting or anything like that. I see the skin looks pink. It doesn't show any signs of cyanosis. I'm not seeing any kind of retractions or heaves or dyspnea, no accessory muscle use. Let me just go ahead and I'm just palpating. Can you take a deep breath in? Okay. Expansion felt symmetrically, normal expansion of the chest with inspiration. Next, I'm just gonna feel your back and I'm gonna ask you to repeat 99.
99. 99. 99.
Okay. Tactile firmness is normal. I'm gonna check for some CVA tenderness, so just let me know if this hurt. Any pain with that?
No, ma'am.
Okay, I'm just gonna percuss to listen to the lung sound. Okay, resonant throughout, which is normal. Next, I'm just gonna listen to 6 spots on the back. Let me know, or just every time you feel my stethoscope, take a deep breath in.
Okay.
Okay, so the lung sounds posteriorly are all clear. Now I'm gonna listen to on your sides.
Okay.
Okay. The next thing we're gonna do is test for agophonies. So I'm just gonna, every time you put I put my stethoscope on you, just say E.
Okay. E, 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 E.
Okay, so that's normal. I didn't hear any hyperresonance, so there's not any signs that you have like fluid accumulating in your lungs. Your lung sounds posterior and laterally were all normal. And next we can move on to the anterior chest. So just observing anterior chest, I don't see any, the skin is within normal limits. I don't see any heaves or masses or pulsations. No signs of accessory muscle use. I'm just gonna palpate here for any pulsations. None noted. I'm gonna listen to your anterior chest.
Okay.
Okay. Anterior chest is also clear. Okay, now we get to listen to your heart.
Okay.
First I'm just gonna palpate and inspect the procardium. No vibrations or pulsations, just normal breathing felt on palpation. Next, I'm gonna just find your point of maximal impulse. That's your apical pulse.
Okay.
Okay. So that's gonna be at your 5th intercostal and left midclavicular line. I'm gonna listen to this for a minute to test the rhythm and rate of your heart.
Okay.
Okay, I'm just also gonna inspect and palpate the area if you don't mind.
No, no worries.
Okay, and your rhythm was regular and your rate was 72 beats per minute, so that's all normal, okay? Next, we're gonna listen to heart sounds at different locations throughout your chest, okay? I'm gonna first listen with the diaphragm of my stethoscope, and then we're gonna do it with the bell of my stethoscope, okay?
Okay.
Okay, so the first is gonna be at the right sternal border in the 2nd intercostal space, that's your aorta. The second is gonna be at the 2nd intercostal space in the left sternal border, and that's your pulmonic. Sorry. 3rd intercostal left sternal border is Erb's point. 4th intercostal and left sternal border is tricuspid. And then we're gonna do that mitral area, which is 5th intercostal and midclavicular. Okay, Now we're gonna do the same thing, but I'm gonna do it with the bell of my stethoscope.
Okay.
Once again, that is the aortic at the right sternal border, second intercostal. And the left sternal border and the second intercostal is your pulmonic. Third intercostal left sternal border is Erb's point. Fourth intercostal left sternal border is tricuspid. And then left midclavicular and fifth intercostal is mitral. Okay, so your heart sounds were normal, S1, S2. I didn't hear any gallops, any murmurs, or any extra heart sounds.
Perfect.
Okay.
Good, because I'm running a marathon. So
I know, you need a healthy heart.
I want a healthy heart.
How are you feeling? No discomfort or anxiety?
Nope.
You're not hot or cold or anything like that?
Nope, doing just fine, thank you.
Okay, good. Okay, so next we're gonna move on to your abdomen.
Okay.
So you get to lay down.
Excellent.
If I needed to, I could pull out like an extender on the table, but this is already laid down, so we're good there. I need to lay you down, is that okay?
Yeah, absolutely.
Okay, I'm gonna lay this flat. All the way down. Okay. So I'm just gonna kind of show your belly off so I can observe.
Don't be jealous of my undies now.
I'm just gonna get to the level of the abdomen to observe first, okay?
Okay.
I'm looking for symmetry and contour. Skin is within normal limits. Pink, flat stomach, no pulsations at the
Can you
umbilicus.
say that again? Flat
stomach.
Woo!
And then I'm not seeing any kind of herniations or anything. Can you look down towards your feet, lift your head up off the table? Okay, I'm looking at the abdomen. I don't see any. You can rest.
Okay.
I'm not seeing any herniations or pulsations when you did that. Your face looked normal. I didn't see any grimacing or frowning. So did that hurt when we did that?
No, it didn't.
Okay, good. All right, now I'm just gonna go ahead and listen to your bowel sounds in all 4 quadrants, okay? Okay, bowel sounds are present in all 4 quadrants. Next thing I'm gonna do is listen to the vasculature in your abdomen, okay? First
Okay.
is just the aorta. Then it's the renal. And then it's the iliac. While I'm here, I'm also gonna listen to your femoral artery. Okay. Those all sound normal, no bruise or anything. I'm just gonna palpate your femoral arteries while I'm here.
Okay.
Those are +2 bilaterally, and then just feeling for any lymph nodes in the inguinal area which are not palpated, which is normal.
Excellent.
Okay, next I'm just gonna percuss your abdomen, okay, just to
Okay.
listen. Resonant throughout, which is normal. I'm just gonna lightly palpate and let me know if you have any tenderness, okay?
Okay.
Any tenderness with light palpation?
No, ma'am.
Okay, now we're just gonna do a little bit more deep palpation, okay?
Okay.
No pain.
No, ma'am.
Next thing we're gonna do is, it's called the scratch test. It's a little bit of a strange one, but what I have to do is scratch your abdomen. I'm gonna listen to your stomach,
Okay.
and as I get closer to your liver, the sound will change, and that will help me identify where your liver borders are.
Okay.
Okay, so your liver border starts right underneath your rib cage and goes to about right here, which is normal, okay?
Excellent.
Next thing I'm gonna do is palpate your liver.
Okay.
So I'm gonna put my hand up underneath your back here,
Okay.
and then I'm just gonna have you take a deep breath in and out. Okay, and I'm gonna do the same thing on your other side and palpate your spleen, okay?
Okay.
Okay, deep breath in and out. Okay, good. So I was able to palpate the liver, not the spleen, but that's okay, that's normal. The liver felt normal, within size and texture was all normal. Perfect, okay? I'm gonna move on to your lower extremities.
Okay.
I'm just assessing the color. The hair growth is normal. The toes are painted pink, but the nail beds are pink. Capillary refill is brisk. Just checking for any tibial edema. No edema noted. Skin is pink. Palpating the musculature. Sorry, be careful with your hurt knee.
Yes, thank you.
But otherwise, musculature is symmetrical and normal. Any pain other than at that knee side?
No, ma'am.
Palpitation. Okay. I'm going to palpate your dorsalis pedis pulses. Those are +2 bilaterally. And your posterior tibial pulses. Also +2 bilateral. Okay, while I'm thinking about it, I'm going to check the turgor of your skin. So
Okay.
I'm just going to check your turgor. And your skin rises easily and snaps back immediately, so that's normal, okay?
Excellent.
Good. Okay. We're just going to do some range of motion, so some exercises with your legs.
Okay.
So the first thing I'm going to have you do is just kind of lift your legs straight up and down. Can you go out towards me and back in? Can you go up and down with your feet and left and right with your ankle? Good. Okay, same thing with this leg, out and in, up and down. Good. Up and down with your foot and out and in. Okay, good. So now we're going to do your hip range of motion. I'm just
Okay.
going to bend your knee and put it right here. Okay, can you go up and down? And then can you take your heel and go up and down your shin? Good. Okay, now we're going to do your other hip.
Oh, I'm sorry.
No, you're
I'm
good.
not supposed to do that myself.
No, you're good. You got it. And then up and down your shin. Very good range of motion in both bilateral extremities. We're going to do your strength now, okay?
Okay.
Can you push down towards me and up? Okay, push up and down. Okay, can you push this leg out and in? This leg out and in. Up, down, up, down. Okay, now we're gonna do the hip again.
Okay.
So just push down towards me and up towards the ceiling. Now the other leg, down and up. Okay, and good strength in bilateral extremities too. We're gonna do some specific tests just for your knee.
Okay.
The first one is called the Lockman test. So this is testing for your ACL. Just gonna go ahead and kind of bend your knee here. I'm just testing that integrity of your ACL. That seems good. Now we're gonna do your hurt knee.
Okay.
Let me know if it's too much pain, okay? Your ACL seems to be intact, so that's good news. I don't think it's ACL,
Excellent.
but we're gonna do a few more tests just to make sure, okay?
Good.
The next one is for your meniscus. We're just gonna make sure there's no tears in your meniscus. I'm gonna bend your knee again. Okay. I'm just gonna internally rotate your knee, and we're just gonna kind of go up and down. And now we're gonna externally rotate and go up and down. Okay, that feels normal on this leg. Now we're gonna do the injured leg. Okay, up and down, internally rotated. Okay, and then, so the McMurray test feels normal. Your meniscus is intact. We're gonna do the anterior drawer test, which is just a bent knee. I'm gonna pull it, that's testing your ACL. I'm gonna push it, posterior drawer test is your PCL. Those both seem intact. I'm gonna do this leg now. Anterior and posterior. Those are both good. The last one I need to do is called the Apley's test, okay? So this is a two-part test. The first one is Apley's grind. So what I'm gonna do is kind of push in and then move your foot back and forth. Now I'm gonna pull and move your foot back and forth. Good. Same thing with this one. We're gonna push in and pull. That's distraction, and then pushing it in is the grind. Okay. The knee seems good. Okay,
Good.
so the meniscus, the ACL, PCL all seem to be within intact.
Excellent.
Okay, I'm gonna have you sit up now, and you can just dangle your legs off because we have to check your reflexes.
Okay. Excuse me.
Okay, patellar reflex. Good. Okay, sorry.
That was a big one.
And this one. Okay. Patellar reflexes are intact. I'm gonna do your Achilles.
Okay.
sure we can see that. If you want to lay down for this one,
Yeah.
just so we can visualize. Okay. Okay, good. Now we can sit back up. Okay. And then lastly, we're checking the Babinski's. Okay. So your patella and Achilles reflexes were normal. There was no Babinski reflex, which is a normal finding.
Excellent.
Okay.
Gotta love normal.
Yes, you're so normal so far. That's great. We're just gonna test your gait, okay?
Okay.
So I'm just gonna have you walk towards me, heel to toe first.
Okay.
Okay. Now walk back the other way on your heels.
Like turn around and do it?
Yes.
Okay.
And now back towards me on your tiptoes. Good. And now you can walk back to the bed regularly. But don't sit down yet because we're not done. Okay,
Okay.
good. So posture is erect. You're able to ambulate without any problems. We're going to do the Romberg's test.
Okay.
So I'm just going to have you close your eyes, put your arms out. Okay, I don't see any swelling or loss of balance, so that is normal. No proprioception issues with that. Can you do a slight knee bend?
Can I open my eyes?
Yes. Okay. Open your eyes. Okay, good. No pain or anything with the knee when you did that?
Maybe a little tenderness
Heard a
in
little
that
pop.
left knee. Yeah, there was
Yeah.
a pop.
Okay.
That was just my left knee.
Okay, good. And now I'm just going to look at your spine,
Oh, okay.
the curvature of your spine. The cervical, thoracic, lumbar curvature is all normal. I'm going to go ahead and just palpate the, can you lean forward just a
Oh, sure.
Okay, the scapula, the iliac crest, and the gluteal folds are all midline and symmetrical. And just some range of motion of your spine.
Mhm.
So can you go forward and backward? Okay, left and right, and then a few little twists. Okay, good. You can have a seat. Do you remember what those 3 words were?
Red hippo boat.
Yes, very good.
That was harder than I wanted it to be. Sorry.
Very good. So
Okay.
your short-term memory is intact.
Whew.
I'm just going to review, make sure that we covered everything.
Okay. Wow, that would have been embarrassing.
That's the hardest thing we do here, I think,
Yeah.
is asking that question. I do want to make sure we tested cranial nerve 12, so can you
Okay.
open your mouth and stick out your tongue? Okay, good. Cranial nerve 12 is intact.
Good.
Okay, and then you can shrug your shoulders, you can push your chin towards me, like straight head to
Oh,
chin,
I'm sorry.
chin into my hand,
Yes.
and then this one.
Sorry.
Okay, did you have any questions or anything else?
No, I just want to say that you are so professional and wonderful, and you're the best nurse practitioner I've ever seen.
Good. Okay, and we'll try to figure out what's going on with that knee of yours.
Okay, sounds
All
good.
right, thank you
Thank
so
you
much.
so much.
All right.